Your Excellency, the President of the Republic of Ghana, Nana Addo Akuffo Addo, Madam Chief of Staff, Honorable Regional Minister and colleague ministers, Members of Parliament, Municipal and District Chief Executives, Director General of Ghana Health Service, Representative of Tumfo Asante, Nananom of Kwa traditional area, members of the press, invited guests, ladies and gentlemen. Today marks another historic event in the development of the health sector. As part of the Agenda 111 program, of which the government is committed towards the delivery of 101 functional district hospitals, we are here in Trede to mark the beginning of the program. More importantly, this district is benefiting from the program, and what happens here today marks the symbolic short-cutting and commencement of all districts with confirmed sites. I am indeed proud to be by the President of the Republic to mark this day. The population of Trede stood at 65,895 according to the 2010 population census. Currently, the population is 114,244. It is therefore in the light of this rapid population increase that another hospital is being provided with the requisite equipment and services to meet the ever-increasing healthcare needs of residents of Trede and its immediate environs. The project is to be developed by Ghanaian contractors. As you know, a healthy people guarantee a healthy nation, and government, being mindful of this fact, has moved to show to the people its commitment to improve the health status of all residents in the country. The surest way to improve healthcare is through providing new infrastructure or improving the existing ones across the length and breadth of the country. Your Excellency, I am aware of the strong desire of the Trede people to have this facility, for which the Nanom readily offered land. The policy of the ministry is to provide facilities where communities are willing to provide adequate land for the project and to take care of future expansion. The Minister of Health, under my watch, has made significant progress in addressing the infrastructure gap in the health sector. Presently, some district hospitals and one polyclinic in the underlisted locations have been completed and handed over for use. Somanya in the Eastern region, Weta in the Volta region, Sola to Nakalba, Dupe and Bamboy in the Savannah region, and Tolong in the Northern region. Bekwai District Hospital has been completed in the Ashanti region. Tepa District Hospital has been completed in the Ahafo region, in the Ashanti region. Nsoko completed in the Bron region. Fifu Praso District Hospital in the Central region. Excellency, work is also ongoing, progressing steadily on the retooling and re-equipping of 4 health facilities in Eastern region, namely Com Hospital at Aburi, Tetekwashi Memorial Hospital Mamponekuapim, Chebi District Hospital, and Atibi Hospital. Work is expected to be completed on these projects by November 2021. Excellency, work is also far advanced on the construction and equipping of 6 health facilities in the following locations in the Western region alone: Akontombra, Elubu, Bogoso, Takwa Nsawem, Wasadumpa, and the upgrade of Mpoho Health Facility. These are due for completion in the second quarter of the year 2022. Excellency, the 45-year-old Konfanwaji Teaching Hospital Maternity and Children's Block Complex has also started, and this time I can make a firm promise, Your Excellency, that the project will be completed on schedule within your time. Other facilities which have witnessed similar sword-cutting ceremonies and have either started in earnest quite recently or will start within the next few weeks are as follows. The construction and equipping of 12-story maternity and gynae block at Kolebu Teaching Hospital. Construction and equipping of urology, nephrology, and kidney transplant center at Kolebu Teaching Hospital. Construction and equipping of Tema Sub-Regional Hospital, Nkranza District Hospital, Doma Accident and Emergency Center, and the construction of the Central Medical Stores at Tema. Construction and equipping of 12 new hospitals in the following locations: Jumapo, Kwabin, Nkwetia, Edukrom, Achiase, Suame, Drobonso, Sabronum, Mansum Kwanta, Hwedie, Mem, and Ponkatamanso. Your Excellency, will commence by early September by the contractor Vamed Engineering. Mr. President, all these projects are in addition to the Agenda 111 facilities that you are about to cut short for the first one to commence at Trade here. At the community level, Your Excellency, work has been completed on the construction of 41 chips compounds in selected communities across the length and breadth of the country at the moment. Mr. Excellency, all these 41 chip compounds were started during your time and they have all been completed. From the foregoing, it is obvious that government's commitment to achieving the SDGs and universal health coverage cannot be downplayed. Bringing primary healthcare services to the doorstep of communities and individuals remains on the agenda of the government, and this, I promise, will be delivered without fail. Excellency, ladies and gentlemen, as we are testing today, the government is contributing a lot towards the equitable distribution of health facilities nationwide, and I will urge all partners involved in the construction of these projects to work assiduously to ensure that the projects are delivered on time with value for the investment. To address the COVID-19 issues, treatment centers have been constructed at the 37 military hospital, Pantan and Dodowa. These have been completed and they are in use at the moment. Works are currently also ongoing for these treatment centers at the Kumasi Treatment Center at Sewa, at the Kulindevota region, Zebila in the Upper East region, Sevia Sawenso in the Western North, and Kolebu in Accra. Other sites are Sunyani, Takradi, Nalerigo, and Cape Coast. Excellency, all these treatment centers have got financial coverage, and we have promised to complete these in good time for our use. Whilst the government is putting in measures to provide the necessary infrastructure and the requisite medical equipment, I appeal to all and sundry to adhere to the COVID-19 protocols of hand washing, wearing of masks, and social distancing to mitigate the effects of the pandemic. With these unprecedented investments, His Excellency the President will not waver in his commitment towards deepening healthcare delivery at all levels and ensure that Ghanaians have access to high-quality healthcare. And now, ladies and gentlemen, to conclude, I will urge the community to cooperate and take good care of personnel that will be posted here when the facility is completed. Give them the necessary support so they will in turn give up their best. We are building a partnership, and the long may this partnership continue. I want to thank you for your attention, and may the good Lord bless us all. I thank you.
Thank you very much, the Honorable Akuffo Addo, Minister responsible for health. Daibia wodia oso. Daiwe nipa odi kan eso ya waka nipa bomu a enega na nyina etaye kire no ede Nana Adodankwa Akuffo Addo. Enche bia one ye be kasa na nananom e baaye no mo se amamre ye ntontwene enti moyi akusika frempoma Dorinda se ono ena omeje President Tata Manemfa Nanodisem Embrain. Shall we receive Akusika Frimpoma Dorinda?
Penyini Nana Adodankwa Akuffo Addo nananom atena konya ekune ne anintina yehyiam wa ha oman ni mu mpanifo Ghana manyina mema mu nyina machi o midiane nana akusika frempama se na migina ha na mese nana mese a meya nana adodankwa Akuffo Addo Ghana minda wase a ensado infiem pimienu ne dunsia 2016 ena omampanyine nana adodankwa Akuffo Addo yenyina yekọ agenkro de kom enibre eto abama nana adodankwa Akuffo Addo se wona wofri osono abusuamu osono kukurudu osono yedimachi a yemisa wawia osna yedimachi a yente hasuo mona magina kasampre be paso atobo panto penkura ma bopan oso ama mansanche kuma edidadie moya bida yanimu se ohaw amanne ohia dane yemfutu kukoni dumso ahodo a yenamuyi obeje yan afrimu no kwasem oya asere wadu asabuo baako ade achi a wo chinchini kwa banyina ose Ghana man yensie ntia onyina wa ma sansa didi pame asona ne wa yokobe asona duampem kwa de hyekonkura so keto aso adare oso wa ya asona ba ompre kwa wa prede di ade wo we no saso wa yokoba na wo mie enti me ya sansa me fa ade a me de kire me fanso a me fa ni boom makano meyo oshabodi bosha so adodankwa show boy premeni dankwa Akuffo Addo waye bio Ghana mai yase ya bakwaso ade wasedaka wona wo share yembo esa wo be ma yem free SHS every say ebra na nkwokyere adokoro Ghana mai na yaka yansam kyerɛ mampanyini dada na wode hye adum ne adan no nana adodankwa Akuffo Addo mobro hunofo agya tema agya abadaye agya wo ba ya no wa be yi nkwanua kase we ya free ekwamu the free SHS aba ase emanyina yankwa SHS free wa bra yantua teku dama sempua kaprempa na wa mampanyini na adodankwa Akuffo Addo se nempo ya na wasia enchiri me beba ebeka se bema ba wo be yebi ye bekwaso ade wasedaka che na adodankwa Akuffo Addo ma yati asia se wonyan hyehan ema man fofra emfa won raba sem ene won crutch sem ensisi ya man Ghana ne sentino wasem mofre ne ye dache mofre ne ye nanida so mofre ne betumi ama Ghana etumi etum pon akoso enti free SHS na yenti ateku ne dama no oye nimdifo oye ngomanimfo oye kukodrufo oye nimonyamfo na nimonyam nyira bedem enti na free SHS no SCP esita ashiri ejina amampanyine na adodankwa Akuffo Addo yada wasia ensada ansoha wasada planting for food and jobs abaye planting for food and jobs abaye ekwama ye friend sekom ebinde yana na yase wa mampanyine na adodankwa Akuffo Addo batampe yada wasia ensado Ghana maya bada swada wase ebra COVID-19 to ayem pofrim na ni da so asaye na ya bisa ya ho se ehemfa na yeko every sana nkrofo je se Ghana de anka ya kan mfra ho kaka wane tebremu na adodankwa Akuffo Addo yen senkyerani ema ya hunu ne sasa Ghana ya omai Joseph awoma ya yu asem mada biara day woma yendidida obi ka kire ya se warenam no akadompe nanso na adodankwa Akuffo Addo baye waseme ya Elijah mekasa namba badompe no ho enade waye adwuma enama badompe no ho se yedidi ama ya ho toye COVID-19 brema ni aso amampanyine na adodankwa Akuffo Addo ba ma be apampamira watra banso aya kataso akata mpempem adadaso one kwaso ebru one kwaso aso one na woma yem 4 interchanges, one district, one factory, one village, one dam, one constituency, $1 million, one constituency, one warehouse, single ticket inflation, online passport application. Also, man, penny na adodankwa Akuffo Addo, wayabi was say, in penny for ne kasembi, abwa petupre, was who be Benyamia na me yadia inti, yadia na mo yanko pasechi, or Susane who send me tibone, and Tina na adodankwa Akuffo Addo, Bama ba one kwa was so dance what it shemase, and now bayano, or so am I hospitals, ya rebiara, would ya fabra one Tina Magana and Jingu. entatem pansamosa enti Nana Addo Dankwa Akuffo Addo waya bio Ghana man bekoso ada wase afia twam ya ana wo hye yebo na ebidu se wontumi nye nanso wo kira se mimi frama nyoko papa mu yade amamo papa na bo amasuo enti mentena ho anya nhye han ama Ghana njinku se anne bo hye na bama ni yaso wo hyebodi bo hye se Nana Addo Dankwa Akuffo Addo onyina ho ma sansa didi pame asere wadua sabuo bako ade che wo chinchiri kwa banyina wo se wo mansi asientia Bama ba osi prekete otri prokuso nyar sabu akwanya sabu nkama kanta wuso ya bekoso ade wasedaka ane aso hospital sero awasa mensni bia enya ayaresabia mantam nsia bama benyansa ninim difuo ono na wodira kwanchan krampa wahunu bi enti ya friend se ahunta hunu te katre wono na o ma ba to ena se waba na se wo hyase e wo tre de krodua yi mu a ni asema mpanyini yenya wudeni wesemenhia wenimtifo wenwomanifo Ghana ma yenhia wa enka wo wotiri modemfo de wafa dodo na wo COVID-19 bremi nana yeda wose Ghana mai bekoso ade wasedaka moni adwuma pa wonkwaso aburu wonkwaso aso se enne Nana Addo se wo ya na moma yanka hunu se suputupu dum abrewa na abrewa dum supurupu ana bra supurupu dum sopropa na sopropa dum supurupu ente moma yenira yamfa Nana Addo na wonu enyedu na wontumi nyina pinti emfa yaresabia dodo na emra ayame menewo ya dachintia ayame menewo ya pamudintia shenipa ba konsanso nyame ani kato ana ba akufo redru so egu penyimfo mpose ba akufo so nchiredanfo mama ya nyina yanka hunu ne se apese wo hoi oyakasia onyamfa oyamadufuchie ana no maba anasa akokoba ono so frikosiamu na baaye woye meye no mampanyini ya Ghana bekoso afane ntoma pefra ama yakan yafra hunu se ye wo man Nana Addo bema ba wonkwaso Ghana man ye bekoso ade wasedaka mo ani adwuma pa adwuma rampuntu adwuma ra wonkwaso a okudonto
yeah. Okay, thank you very much, Akusika. Now we'll present to you the precious gift of the nation, the President of the Republic, Nana Addo Dankwa Akuffo Addo.
Eminent clergy, Chief of Staff in the Office of the President, and officials of the Presidency, Ashanti Regional Minister, Minister for Health and Member of Parliament for Doma Central, the Minister for Local Government, Decentralization and Rural Development and Member of Parliament for Okre, the Minister for Works and Housing and Member of Parliament for Bantama, the Deputy Minister for Defense and Member of Parliament for Etrima Kwanwoma, Members of Parliament, CEOs of state agencies, Nana Echina Kwejain V, the representative of Asante, Nana Nubi Mfra III, Tredahine, the General Secretary of the New Patriotic Party, Ashanti Regional Chairperson of the New Patriotic Party, residents of Trede, fellow Ghanaians, ladies and gentlemen. Today is a happy day for Mother Ghana, and I'm glad that it is under my tenure as President of the Republic that the biggest ever investment in the nation's health care is being made. We are met this morning because of the ravages of COVID-19, which has affected every country on the planet. For us in Ghana, not only has the pandemic disrupted our daily lives, but it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Indeed, in update number 8 of the Fellow Ghanaians series, I indicated that COVID-19 has revealed the unequal distribution of healthcare facilities in the country, as we have tended to focus our healthcare infrastructure in Accra, Kumasi, and one or two of our other big cities. As we have seen, epidemics and pandemics, when they emerge, spread to any part, can spread to every part of our country. We discovered that there were 101 districts in the country with no district hospitals, and we had to do something about it. The creation of the new regions also meant the government had to construct 7 regional hospitals for the new regions, including a new one for the Western region. See to the construction of 2 new psychiatric hospitals for the Middle Belt and Northern Belt respectively, and rehabilitate the Afian Kwantar Hospital in the Western region. This led to the formulation and declaration of Agenda 111. Following on from this initial announcement, a lot of work is being done to help make this vision a reality. And I'm delighted to be here with you in Trede to cut the sword symbolically for the commencement of construction of these hospitals across the country. So far, 88 out of the 101 sites have been identified, including this one at Trede, the site for the construction of the Etrima Kwanwoma District Hospital. Work on the other 87 sites also commenced today. The acquisition of the remaining 13 sites will be completed shortly for work to begin. Each hospital is being constructed at a cost of $16.88 million United States dollars. That is 12.8 million United States dollars for construction and 4 million United States dollars for medical equipment. All the hospitals are to be completed in 18 months. Work will commence on the regional and other hospitals in the latter part of the year. These modern, fully equipped state-of-the-art hospitals will have facilities for outpatient services, including consultation facilities for medical and surgical cases, ophthalmology and dental services, a physiotherapy unit, maternal and child health unit, public health unit, 4 state-of-the-art surgical theaters for maternity, obs and gynae, accident and emergency, and for general surgery and imaging facilities. In addition, each hospital will have the full complement of male, female, pediatric, and isolation wards. Provision has been made for support facilities, which will include a kitchen, laundry, sterilization department, mortuary, energy center, maintenance department, and staff accommodation for doctors, nurses, and other health workers. Ladies and gentlemen, Agenda 111 has been carefully thought through to inspire activity and growth in various sectors of the economy and also help bring jobs to the youth. It is a Ghana first agenda, and the following facts will help make the point. Firstly, a consortium comprising some 20 Ghanaian consulting firms made up of architects, civil, structural, electrical, and mechanical engineers, quantity surveyors, biomedical engineers, and other technical teams have designed these hospitals to reflect our unique domestic requirements, including impact of climate, socio-cultural conditions, and traditional practices. They will also supervise the construction of these hospitals, which will be built by some 250 domestic contractors and maintained by domestic facility management professionals as part of government's policy of developing domestic capability in the building and construction sectors of the economy. This will undoubtedly help retain most of the money in the country to engender further investment in the economy. Secondly, the hospitals are of a standard design and construction to provide a blueprint for speedy and cost-effective implementation of future health infrastructure programs in the country. Thirdly, the execution of Agenda 111 will require significant domestic inputs, which will give impetus to private sector investments into the one district, one factory policy. I expect Ghanaian entrepreneurs to take advantage of the opportunities provided by the significant investment and produce quality building and construction materials required by the hospitals. Fourthly, we have incorporated into this agenda a strategy of direct and indirect job openings to stimulate the economies of the various communities in which the facilities are to be located. These include the creation of an estimated 25,000 jobs during the construction and design phase, i.e., jobs for architects, civil, mechanical, electrical and biomedical engineers, quantity surveyors, masons, carpenters, welders, steel benders, painters, tillers, and related professionals and artisans, as well as other indirect jobs. Once completed, it will provide job opportunities for some 20,000 health professionals, and thus enable the Ministry of Health recruit more doctors, nurses, pharmacists, and other health professionals. In addition to these, there will be many indirect jobs for residents in the local economy. For example, for persons who will sell food, drinks, hospital consumables to the hospital, its staff, patients, and visitors. I am confident that this important investment will have a positive impact on many lives and livelihoods in the respective communities. Ladies and gentlemen, beyond the building of these new healthcare facilities, my vision is to help make Ghana the center of excellence for medical care in West Africa by 2030. Leveraging on Ghana's favorable status in the region as the most peaceful country in West Africa, a beacon of democracy of the continent, and a land of opportunities. This we will achieve by investing more in the development of our healthcare infrastructure, mapping our regional health facilities to specializations, as well as upgrading selected facilities in our regional and teaching hospitals into world-class standards. Excuse me. India and South Africa have shown the way in this regard. The relevance of this is reinforced by the fact that West Africa by 2030 will have a population of 500 million people. The goal is thus to position Ghana as an attractive medical destination with excellent medical facilities for our neighbors to patronize. Several countries have benefited from international medical travel. Benefits to these countries include enhanced GDP growth, improved healthcare infrastructure, foreign direct investments, tourism promotion, and importantly, halting the brain drain of skilled medical professionals. Indeed, research has shown that in 2016, for example, Africans spent some $6 billion United States dollars on seeking medical treatment abroad, of which Nigerians, our great neighbors, alone were responsible for $1 billion of this. In order to take advantage of the huge potential for medical travel, we began during my first term in office a program to revitalize healthcare infrastructure in our premier hospitals. Investments were made in the Kolebu Teaching Hospital in Accra to build a new 400-bed maternity and gynecology block, and a new 100-bed urology and nephrology center of excellence. Government will build on this foundation and include 2 additional projects currently in the planning stage, namely the Trauma and Acute Pain Center and a new surgical service block with modern inpatient facilities. These major investments in the Kolebu Teaching Hospital will contribute to its transformation into a modern world-class teaching hospital. Further investments are being made in the Akuffo Addo Teaching Hospital in Kumasi, beginning with a new 550-bed maternity and children block, specialized centers for infectious diseases, orthopedics, cancer treatment, cardiovascular health, specialist eye care, among others, will be assigned to some of the regional hospitals, including those to be constructed under Agenda 111. Whilst we upgrade facilities, we should invest in medical education and training of our health personnel, including expanding the use of IT for medical diagnosis and treatment in the Agenda 111 healthcare facilities being developed. This network of primary, secondary, and tertiary healthcare facilities will form the backbone of the vision to make Ghana the leading healthcare destination in West Africa. It is envisaged under a public-private partnership that the Ghana Medical Corps, a volunteer corps of medical specialists, which will tap into the skills and resources of Ghanaians and non-Ghanaians locally and abroad, using IT and telemedicine to support the delivery of healthcare and training, will be established by 2023. This will offer in particular to Ghanaian medical experts resident outside Ghana the opportunity to give back to their motherland in ways that will support and expand healthcare delivery. All these programs collectively will position Ghana as a medical travel destination in West Africa, with the potential to add some $2 billion United States dollars to the nation's GDP by 2020, and in the process, create some 50,000 jobs in the sector. The implementation of Agenda 111 will be a huge undertaking, requiring commitment, cooperation, and diligence on the part of all: government, professionals, contractors, traditional rulers, opinion leaders, workers, and residents of the various communities to enable it succeed. We owe it to each other to prove that we can do it. Let me conclude by thanking the various stakeholders, especially the hard-working project coordinator and consultant, Kwame Nyako, and the conductor of the orchestra, my redoubtable chief of staff, Akuffo Addo, who have worked tirelessly to enable this project take off, and remind all of us that we continue to experience the effects of the third wave of the pandemic. It is important that we continue to adhere strictly to all the protocols and directives government has put in place to protect lives and livelihoods. Continue to wash your hands under running water. Use alcohol-based sanitizers, hand sanitizers. Wear a face mask and ensure social distancing. These are the weapons of our welfare as we strive to reach the target of vaccinating 20 million Ghanaians, i.e., the entire adult population. I'm very hopeful that by the grace of God, we are on the threshold of something remarkable in Ghana. And I expect that within the next 18 months, God willing, we will all be alive and in good health to witness the commissioning of these hospitals. May God bless us all in our homeland, Ghana, and make us great and strong.
A round of applause for the President of the Republic, Nana Addo Akuffo Addo. All right. Bayi yabatanas na sene na Nana Achina kwejan okaye no project yesase na amfo say oh President Asmo Kendi e wo dududu hospital makuma 80 there away there waye bayi also diaper ojudo huye na o bayi ba bia okobia nso yana okasa chen okasa na abebuom na your excellency have been following your wardrobe and then our bayi okasa chen asma okaye no atade e na wache na ohe obampayi ne ntuma no ndidia ekasa chen asante abamremu yeka ntuma e wasechre ene obampayi na atade no anasa ntuma no ndin ene se woni sika ye ntwa blocks woni sika ye ntwa blocks obampayi wose wanye sika ene wotwa blocks no awo ha enti ntuma no ekasa chen se ampa dia mo kanyina na wontimi wose wo sika wotwa blocks na blocks no so ye kwakwaye ewo ha eno na megyina so na matumensa ade afre Mr. Kwabena Nyako ono ede ye project consultant na adoforo Mr. Mochina so ebai e ade a omampayin afei the chief of staff and afei otufo obofo kese a wo ha and the honorable minister of health and Ashanti regional minister Emeka na that the kine ho na omako babia especially ewo yegyina yebetrase na omompayi yekohwehwere mu sane yeye no ni asefo nyina blog no ha dewo omompayi kowia na yasan ato djumadi ni so Edinti Nana Wadama, Nana International Wadama. What's the
ministers from various departments, MCs, ECs across Ghana. Omampeni, could I also be allowed to speak in Twi? Yo, Midas. And I need you that Emma Ghana Mai. Aya Mampeni, the Niswadia Unaya, and Abem said you're not many penny canon, and as you know, no, said the one I feel intimate muscle and Abaso. Naya and another walk to Mako and now what the power we in Naya Tower. If we say Yemra Santine or Yimpuntu in Tiabasa, Nabrimpon for Adia, a woman Puntu Ababiano in Yata HD. I thought should be one penny to D, what was it Cabinia? Meet me country. Not just as you can put your body at the Rasa Japadia, Yan Wagana, Mantam in Nayanuma, yes, is in where you grow. Yes, again, you can't show as your Tanachi. Say free say yes that yes ye e ko pim see be wie ya rasa japade ne so free say ni nyina e yeska abrado do na abaya japade bebre ya ye nyina ye hweso ye e ba so a ye boso bo tie nyina ye nkamo ye rasa dumadie trade fie die mi ame wa ha e ma mani akọ ho mi nuanom so amunya akọnya ye si bi wo mo mpeso aso obi anta akire on fa na da de e nkwa wa no That should be a Mama, Omampeni, why a Bramaye, why a Bramaye. Yeah, what is a dear you? I mean, John and Anuman, and you are two and you may have this idea. Yeah, district, you know what I can say. Tis a one Yabiba, Nassim Chamuna Bebemoa, and I say, elevation, Papa Jim, Afri district level, Ako municipal status, Wadama. Yes, I will show. Yato Suye, so Yakwai, Adama, Majati, Neve, Miditray, Namini Anamo Makaso, Adama, Midroma name, Namidi Adis idea, Atu, when him. To my dear, he said, Yokai, the Babe Bray, when this one dear by, I know my territory. I said, I can see and come out woman penny. Chief of Staff also accident come out. Apamfua Omampeni one what to clear house. The free architect, layman, Obia Muna, Nananum, Atumako, Mamidroma name, Adam Wasi. Regional Minister, what do you want to MP, Onososo Abua, DCE, Tower Country Planners, on what Makwanuma, Asasi, Yadima or mine. Oma na aboy ami abon by omuso aya de nti e wase da kese e de mo mampani mi jana na no madam ai wa tuma kwa ngoma wadama ye wo achede bia ye pese ye de mo mampani e free say na de wa sha ya ni mo nyam na me ami ma mi so so dubikete ene o ha kan ni beje ti e wa achede kese ami ami di akire na me di aba na ma jana na mo na yeah, that was here. That's it. Money, oh, Nana, I said that he had an agenda. What? Yes, I said. Nana, I watch it so quick. But the Emma over Nana, other than Akuffo Addo.
You didn't carry Madam Mampeniase. Now, make us a project with the it's long overdue. Since you heard any more chepa, na if you feel best and Pimion and some honor, Memon and I'm soon to my friend Anna Usubedu. We as it was Yemfania Ayasabia. I check, you heard any more, and there's a baby on a bread. I feel the brass one, Yamincha, and the president, the answer above him. Now, for so dear, they be brain at the brain. So here in Potemha, you near Sabia Casabia on Potemha. Yenina is it to conquer as the Sabia Dominase. When you can flew her and you cry and ya abind ye. The Cassia here by Sabia Power, district Yadia. If you have Copa from a trading, you need be. nti we de mfaso de yebenya bebre beboa ye mantama afọ de beboa nyina beboa ye in terms of health de yebenya mfaso bebre bosum di nwatwe no mampani aka ye ti bebre we de bia timi kase bi kura mfie mi no be na konfiansia bosum di nwatwe ye bompa se mpa ho de na se moya ne bebro ye de beboa contractor for ne de e de se ye wa no mo ba yini mo hawo ne mo ehunu se bia nanam bia mehia we ya yenso bitu ho anamon nti de wo hawo no me yehunu no ana yenso bi hu de se ye de boa wo mo ehunu mo hawo de ya ye wo ho nanam de be ya pono na atra hin wase obi na pono mo bia wo hia bia no ye be boa mo ama dwumade na timi akoso na atimi abaso se de mo pani aka no yo ene koshia me nyini se yehunu MPP na DC bia ho ana PNC na party bia enyina nipa ba ko ye ko se tredefo mesana mjiri se adwumafo nyina so ye ko se nyina se omanma ene ye ko ye adwuma yenyi politics na ade influence na MPP nyina yenyi film de nyina ye ko ye adwuma se oman Ghana ma ai nyina ye fight for a common goal ye pese nya ayasabe hospital ti mjiri se party sem de ye mfanya adwuma kora nyina ye nya adwuma se tredema ne Ghana ma na intime madwuma de intime nwie pe mesre na namo abremponfo na mama hene a omuso omunkura hodo so dwumadi se ba de din ka eboa oman no ma oman no nya hoden se oman health nation oman a wo nipa mu hoden na de man ye healthy se ye do asabe se ba oman mu na se oman fo nya hoden oman nya resa no matime adwumadi abo oman na mgisa asempa timesra na so obi bia beba se ese ehia asase 87 aka no ye di se adwuman o makwan na nya asase me ma oman na president no fani se adwuma no misre omo ana dododo for na mpe bebia na wahene kura de person ko obey o di asase be ma no mo do so mo di ani no ya no mo dwen sa asase ko ya mo dia ndi so wahene ne kura kwa ya na dododo for kura na asase kwa ya manson o di dia asase na nya o ne dia asase na wahene dia nti mesrem na namo ahodo maka nyina se ba wonfom na nsi fom no mo dia na yarsa de ehia mo mai bia nti mo dia se o mo dia asase be ma na se ebi ma akura na wotete asase na o ye layout a no yi ba bi ato se daachi bia bibi se ba ye dia se de yi to 2007 efie dunum ne yabon ho bai sa bisi ne nti mesra na mo aka na mo abrempofo na ma henfo no o mo tete asase na o mo allocate ba bi se daachi bibi se ba ne dia na se de ye dia asumdwa ba boko yi afutam ne mana na mo no
Pache Busawo your president agenda 111 year or the abai say as a staff we work national. Do you think this project is possible?
Oh, it is possible. It is doable. Adia abana with my year. Sentina, yeah, no. Yes.
No, Ebi Kase, your president can say this year a year of roads. And on Sunday, a Juma we have a canon. When you say too much on the president,
and you're too much, and on management, and planning. It's too much. How you plan, how you manage. Abai with my year. Oh, to me, Yanka, Onka.
Okay.
Oh, Papa, Yamian Gane, Niji Sempa. If it's a sadio, ya try to teach a man. Say, oh, Baba, you near best work, be do what Jean. It is a Yamia, don't, Nessa Nanado, activity said to my dear way up prayer. The air can say Yamin Shrano, near Nisway day, at Japan, at Tomakwa, Homa for, I'm your woman organizer. Because there be a boy so and anana at Tomakwa, my mayor say. It is an Yamia, don't. That's our Tomakwa, my sister hospital way. I what's the Yamian Queen, Yaniaji.
No, but you say this agenda 111. Then I'll have it, Mama. Said you I possible in another 3 years. I can't.
The only did any sense of Yamia will be a better dancer, so my penny and not to Akuffo Addo or buy no or Casa or Bayani Mapibri. And the more Casa or Bayano, why, oh, share COVID-19 by and now, which I the baby as a fan engine now. What to me, I am near my Casa or Bayanoa. And just Saturday way I work and now didn't have a boom or the into your idea. Why you be that? It's your Casa Bay now, and yeah, will be our one. You so to me.
Now, go for Casa in this era of COVID-19. And a president said this year, real road or start the hospital 111 88 now. They can kind of count. Ain't too much on the president.
ansa bomo cheche finsi ase beka so dan chema wu a ye di na chinye e bia ne sa me ka se o hwe ewi ase afa na ba bia abra sa ya die we ba ye no sabi na akatua mpo na mo tiri fa mo ma adwuma enfo ne so ma panyi we hwe se obi bia na otifi a onye adwuma bia kra no na akatua koi obi enu na akatua kam e kire se owo ani so de hunu a o sa wo enipa bia o ka so ba ya de o ba ye ye se ye de ehia ansa ye de fata ade we oba no na ka ni na nisu a aka watimi anye etuwe ye waka so be no ye be sika na fo so obi a internet ne ye ma ye bre obi a be hu se de ka so be no obaye amna efe no obi a so hu na mishika pa
oh waya ade ebetimi aboa ye ama bibi atimi akoso obi yare a ya fe ne ye de ni be twa kwan yeda na se na mi tira no
amafo ka se anka hu hia ebise mo wa kwan a enye e wo ha ediso ye hospital kwa na kwan ne nya ye be de nipa na ba woni san kofo ne ya adwene
me no wo nya adwene me no ye me tell say me no wo nya adwene say hospital ne ye obi yare kwano obetimi ye ban obetimi ya ban nkakra etimi bi abeduma tune bi no ayare sabia ye no so ye betimi aboa ye wotimi ye wo wie no wotimi ye no so a betimi aboa na bibia ya kama
bedawase minua ene me chia watiefo nyina omo tie no asopam no omo online nyina ene ye ni gisam kese pa soronko ema Ghana man nyina as ye kan no hwe district se wo man mu a na omanpeninya vision no eba 88 e de wotwe na se bi omuni hospital kra a obi yare age se de no etukwa bi akọ ekonfa nochi ana tamale ana enkran ana Akuffo Addo regional capitals district nangasa de hospital ebi ni honom nti nyina ana de adwempa ne bai no sense se ne on bo ka sen cafe but Jessica some ne want to yenti no se na yaba na we short cutting I fresh we trade the hanum but nyina started all across the country nyina best at regional hospitals so na also later in the year and early next year on start yeah the pa is say ebeboa ayare sabia ni nyina so be accident emergency ka ho baby a ma beja work ka ho baby a nkwala ye hwe o meka ho impinifo ko surgery so hia intensive care ene baby a be hwe umoja ni wahore ni imaging ene lab test ni nyina baby o mesi bibia e bia ka ebeboa pa.
No, me your president. I can say within all these Nemana war, he's using 18 months in a year's Jumawi. Osha, is it possible to finish all these projects within 18 months?
Yo, man, that's so bizarre. Is possible? Is answer? And one contractor pay NAC sa enemy. Omandi ma MC Bakubiano one contractor NAC. Into no, it's answer different contractors NAC into. Ometi from start to finish no. Ometi me. Musa Ghana in Sansini one mana a sabu na manso kakra ho. It's answer ahemfo ni nkunyan 70. Ubwana assassin bia na ye sabia da kunyan ho. Ubu na assassin na eda abusuanim on dem jana na intino ni nyina ya say mo resolve nema no. Ena nti ya ne bo ma na koy court nsam ni ade nti nyina na obetimi resolve ni eneni ochina ya. Abanzo otumi bi obetimi agye asase fi ohene bia na say but nana anya ni sa. For example go eminent domain. Man penibet ma jasase bi opebia especially said the year hospital and schools and akwanya but yes no yen na de no pemra nya de adintin osemo abusuafo no nya ayemfo no montrance ohia 18 acres baby a hwese de photo nya de staff but 15 acres so baby a no de ye edim se baby de se kumase ne nkrane tamano de ye nya 15 acres na se ukum eno so no moye no ho ekadodo ebehia Metka mefo akonwa so akire ahemfo no sense saa de wusi won ma bema adwuma ba ebia wo oba na ona na kra benya adwuma ni bi afenso no West Africa hanum no nya hospitals bebre ne doso enti no mo fi se bio Nigeria mo free Togo mo free Cote d'Ivoire Burkina mo nyina e ba ha no mo ba so na mo de mo sika ne ade nyina de e be hwe mo se de bi free ha go so mo yare sabia wa buruchire no mo nyina so ba hanum. You see a Ridge Hospital, nipa be breed me feel Liberia near the Baba Shop. On Benina, right.
Doctor, my main phone free project 111. na memra na Zoom Health here also or this 6 months ebe training SHS for into health facilities no. Is it possible because 18 months you were almost movie nursing training from 2029 2019 and 20 you know. Don't you think that it's hard time we employ these people than training another SHS for into doing the same job necessary, you know?
You see, everything begins with the vision. A president or a leader comes with the vision. Almost nurses war, technicians who pharmacy techs, any other people who now who training them. Who said, "Do na ye emra obesi sono." Na ibi no mo matena fia mfie mienu mfie miensa mfie nan. Mini ebi ko mfie nsia. Asampa na megajo. Nti ye fa omo a but who say we no manje lucky o metimi akos extra training beyond SHS. Na ye nuan ma say bi o mantimi anko SHS na hopa no mutimi o madisua de esi no. E den ye de ye boa om. Cause mo hia bibi adwuma kakra metimi ade ahwe omo ho. Nti we a special extra project or dey ba e be job creation ama emabunu no. Nti na ye vision esi esum. Na omo metumi na ye betumi use be a health tech and a health assistant. Even now na the files na ade ona kofa be a medication ni nyama brain nurses na nyina so mu. Nyina so boa.
Anu dia obisam ya ebedin kakra because omu dia omutimi de boa ye land. The provision of land a manso bia ni so baby bebre ho no nananom na de asase no man say it asase am say ye ni sa adwuma wo so eti no ya na encumbrances bia eni ho eti 88 na ye nya no nananom e wo pa na nya those lands no fa ba me ho man so du bia constituency nananom nanadu bia hene ene nana kanse hene no mu kan muti bom no mama ya sase kakra na edidi sa adwuma no a few individuals so mo ayi ba mu no compensation payment everything is done so we have secured the land that the neighbor starting to be say nananom rope there land acquisition am I to me the question this one say there is a program systematic program they have their roles to play and these ones also have their roles to play training and they will go to these other health facilities and I say communities are more on Bayer side Jumano and no when most of the specialized area the two can go on at the same time.
Thank you very much.
Typically for us, by the time we get to the stage where we are on site, it means that all the preparatory recs have been done. The contractor is ready to go to site. So it's a normal contract procedure, the process that we'll go through. The contractor will start work. He starts with excavations and foundations, and then he'll do the substructure, do the superstructure, put a roof on it, and so on. So we expect that going forward from now, all these activities will begin at the site. The district hospitals are standard design, as you can see from what we have here. This is just a typical of what we'll be building across the country. Each hospital will have facilities for pharmacy, consulting rooms, it will have labs, laboratory services, it will have imaging services, it will have maternal and child health, it will have theaters, it will have wards, and then you have the supporting services. So kitchen, laundry, sterilizing units, maintenance, and the mortuary. So these are the facilities that will go into so it's a standard hospital. It's not a polyclinic or anything. If we had more money, yes, we'll probably do a few more fanciful things, but it doesn't really detract. Or maybe we'll asphalt all the roads in the area all the way to the junction, and we will we will build 200 staff accommodation, or we could do a lot of fanciful things, but I think we are aiming to deliver a standard hospital, which will be useful to the local community. Yes, each hospital has staff accommodation. We're encouraging the private sector to also team up with Ghana Health Service and Ministry of Health to provide its staff accommodation, because obviously it won't be enough to go around. So we're encouraging the private sector to also look at that and support. Well, they've been very supportive already. A lot of them have given land together with the district assemblies for the project. The consulting teams, technical teams have been around to all the sites. They had to undertake soil tests. They had to undertake surveys and so on. So they've already been very helpful, and we'd like to extend our appreciation to them for that. Going forward, we'll be working with them, working with the local communities to ensure that we're able to deliver these hospitals to the required standard. They've been extremely cooperative. They want these hospitals for their local communities. They see the benefits of getting a good standard hospital in these communities. So a lot of them even took the lead to approach us, with lands and so on. So they've been very cooperative, and we'll continue to work with them.
Oh, Nana dear, why are dear my pa? Dear, what dear Bakroma, dear Wabua, the mine. Asambua district Nina, Yamani and Nananum, Ubibia, Benya, Jumaya, and Tina dear, why are dear my pa? Yansu Tanachi. The America Minion and Traconia say, Ubibia law was a Sibia Nadauroma. Omwa no man and I be now omwa or mino, Nananya adepa, Emma in Chirimano, Amadachi be niwa, Yamano so abesia nemu, intimesro bibia say, Obibia war as a Sibia, omwa no man and I be no omwaye, na ye kruno, enye krabeshe, na enya kesiso. The Macachra Obibia and say, Jumadi Aban, enya MPP in Kwa, and enya NDC in Kwa. Eyanina, ya mani and nananum, entinana, abaya sadi, intimesra Obibia say, on fa any jay now, keka, sronko, and fanta Jumadi yachi, nenya ye maye. Na china bi eniwa ye manom so abesia na emu
ojumedi na nadu dia baidi good pa bebo atre the mine any mebu no because so sha ha class any hospital kese bia wo aha ba bia to we na bebo ama mebu no class be nya dwuma ye ama ekure so empuntuo no etimi akonanim ama tra de kuro no class edi no so kra etimi akonanim ye so say nyina ye MPP4 eni nyina so ye NDC4 ye NDC for the when to be say we need the adwuma ne de e be ye obi a wo be qualify say wo betima ye adwuma wo ho ene ye be fa wo nti ye mfa wo say wo be ye MPP na say wo be ye ayi CPP ne be ye obi bia ne nyina be ye say wo be qualify say ha no wo betima ye adwuma wo ha ena ye be fa wo say ye adwuma wo ho sana me sure say na do be ye no